Hi, I'm Dr. Randy Baker, Senior Partner here at Grand Health Partners. Today I'd like to talk to you about GLP. GLP is a hormone that's produced in the body, and it's very critical to what happens with obesity and diabetes, and I'd like to explain it briefly. Basically, you have the entire GI tract, and at the end of the small bowel are receptors, and what they do is sense undigested food, carbohydrates, and things like that. And if they sense more of those things, and they cause the body to secrete things like GLP. What GLP does is it prevents us from getting diabetes. One of the things it does is it makes the pancreas secrete insulin more effectively and efficiently, makes the body more sensitive to insulin, and it decreases glucose production in the liver. All of that helps to keep us from getting diabetes. So for instance, if I eat 2 or 3 pieces of pie, my sugar doesn't spike up. And the reason it doesn't is because the L receptors sense that undigested food and carbohydrates, crank up the GLP and other hormones to keep it from happening. What happened is GLP was started for diabetes. It's been around for about 20 years. Interestingly though, the increase in diabetes continues to go up despite the GLP medications, and it hasn't really put a dent in it. But what happened is they noticed that when they started those medications, some people would lose some weight from those medications. So then the pharmaceutical companies went back and took the doses and amped it up even higher to try to get weight loss. And the way that it causes weight loss is primarily by making the stomach not empty as well. So food stays in the stomach longer, and that's what causes the weight loss. Now the GLP medications are the best for weight loss meds that we have today, but they have some issues. Number one, it's because they cause the GI tract to move more slowly, they cause side effects like nausea, vomiting, bowel obstruction. In addition, because they stimulate the pancreas so much, we're seeing issues with pancreatitis, about a 9 to 10 times higher risk of developing pancreatitis, which is irritation of the pancreas. We're starting to see this in surgery now, where when we go to operate, the stomach and the pancreas are stuck because of the inflammation from the pancreatitis. There's other issues, and that is there's issues related to irreversible blindness. It's very low, but it's a serious issue. Ozempic face, you've probably heard about that. There's a number of other things that patients are seeing as well. We actually prescribe the medications, but we think they're best used shorter term. When you take these kind of medications long term, you're starting to ask for more problems. And then the final point that I really like to emphasize on this is what is the actual weight loss on these medications? And this is where it becomes a little bit interesting. If you look at the pharmaceutical supported studies, they're showing way more weight loss than the real world evidence of everyday patients taking these medications. And there's a couple of reasons for that. Number one is patients are pre-selected in the studies that the pharmaceutical companies did. And secondly, they were having those patients get the medications free, so they weren't having to struggle with pharmaceutical approaches and paying out of pocket and all of that. And finally, they actually put all of those patients on diets and had behavioral change components as well. And today, most of the patients that are getting these medications are getting them online or through physicians and do not have dietitians, exercise physiologists, or behaviorists involved in the process. So I did a big report, and we're going to make this available too as well if you're interested in looking at it. But one of the things that I wanted to analyze is what is the weight loss expectations of patients on these medications. And if you take a look here, you can see, and we'll show this, and that is that in the non-industry funded studies, the average was about 6 to 8% of total body weight loss with the medications. Whereas in the pharmaceutical supported studies, it was right around 15 to 16%. Again, average. This is with a whole bunch of studies that were averaged. Basically, the real world evidence was 57% less than what the pharmaceutical sponsored studies indicated. So what I think this means is you have to take a look at how much weight do you really need to lose. That's important. You also have to take a look at, are you at a higher risk for some of the side effects of these medications? This is why you need a place like Grand Health Partners. We do this all the time. We do medications. We have a medical program, but we have dietitians, exercise physiologists, and behaviorists. We have an entire team to help you. We can talk to you honestly about the pluses and the minuses of the medications, the different types of medications, and options of surgery, pluses and minuses of surgery as well. If you're ready to take that first step, we'd love to talk to you. Contact us at grandhealthpartners.com. Thank you.